Elliot Smith. I'm a research scientist in the neurosurgery department at the University of Utah, and I study mostly epilepsy and then also cognition, and I study those in human subjects who are undergoing monitoring for treatment of their epilepsy. So the way this works is about a third of patients with epilepsy can't control their seizures with medication, and so those patients have to come into the hospital and get electrodes implanted into their brain, and then they wait in the hospital going off all their drugs, anti-epileptic drugs, and they wait in the hospital and try to have maybe 3 or 4 seizures, and then the neurologists and neurosurgeons can learn about where the seizures are coming from and eventually try and either cut out that part of the brain or put in now they're starting to put in new devices that will actually detect and then try and stop their seizures with electrical stimulation of the brain. And so while the patients are in the hospital, what I can do is then go into their room, and then while they're waiting to have seizures, their brain's basically normal, and we record electrical signals from their brain and that activity of their individual brain cells while they're behaving, interacting with researchers, while they're playing computer games, while they're listening to sounds and seeing sights and making decisions, and then we can correlate their brain activity, including the activity of their single neurons, with what they're doing, what they're perceiving. And so by doing that, my goal is to try and understand how these patients make decisions, particularly value-based decisions, like kind of economic decisions. And those decisions are thought to be also involved with how they might make decisions about reward in general or risk in general, and that will help us learn about how subjects represent reward and risk in the brain, or people represent reward and risk in the brain, and then how that goes wrong when people are making impulsive choices that could lead to substance abuse disorder.
So the reward system you're talking about, that comes up quite a bit in cognitive-based research and therapies. In fact, in Annie Grace's book, This Naked Mind and the Alcohol Experiment, she talks about the cost-benefit analysis. Can you walk us through just a little bit about the differences? Annie's talking about 2 different types of brains, right? What's going on in decision making?
So kind of what we think right now is in decision making you have this representation in the brain of a particular context, and that could be sensory and goal-oriented contexts that different parts of the brain would represent each of those. And then you have kind of a reward signal coming from lower parts of the brain that's usually represented by dopamine. And in looking at those signals, you can learn how particular contexts are associated with particular rewards. And then people think that animals in general just learn how to associate those contexts with the rewards in order to maximize an expected value of the reward in order to increase their reward levels. And that's really easy to overdo, to get stuck in a positive feedback loop, that whole process in substance use.
And that would tie into like that study with rats who were given cocaine, and they just keep doing the cocaine at the expense of food and water, and they die.
Mm-hmm.
So self-preservation, which is at the heart of Darwinian evolution, seems to be overridden by certain substances.
Yeah. Mm-hmm. Maybe the rats just don't have a lower dimensional representation of the context. Right. Or their cerebral cortex or prefrontal cortex isn't representing the context as well, and it's just seeking that reward. Yeah.
So in your study of epilepsy, for example, in my field of applied linguistics, one of the things that was fascinating is the studies that were done in the past on aphasia, a little brain disorder that actually helps us understand the brain better. Are there brain disorders that do help us understand the brain better beyond that, such as epilepsy?
Yeah, so a really important aspect of trying to understand, particularly the human brain, is using lesion studies. That's basically the best causal way of studying the brain, because people are missing a particular part of their brain, and then you can try and understand what sort of deficits in behavior that's causing. So that's a huge area of using brain disorders or brain lesions to understand brain function and behavior. In regards to decision making, another really good example is in Parkinson's disease. It's thought to be involved with dysfunction in dopamine, and so those patients will take drugs like levodopa, for example, that will alter the dopamine signaling. That's kind of that reward signal that's coming into the prefrontal cortex. And in about a fifth of people who are taking these sorts of medications, they'll develop impulse control disorders. So that's another hint that these parts of the brain and dopamine and these signals are involved with impulse control and basically correctly assigning rewards to particular contexts.
So speaking about decision making, let's say hypothetically I'm driving and I'm listening to music, and maybe I'm singing to it, I'm not paying attention to anything else, and all of a sudden someone swerves into my lane and I swerve away. But it doesn't feel like I was consciously thinking about that, right? As opposed to me sitting on the couch watching TV and making a decision consciously to eat more potato chips, or realize another night that I ate the whole bowl of potato chips and I wasn't even aware of it. What's going on there? What are the different parts of the brain being affected by those decisions?
Yeah. So for each decision you make, there are probably different circuits and then brain cell, groups of brain cells that are involved in each sort of decision. For really fast decisions like that, there are these rapid pathways that will send visual information about the person swerving into your lane really quickly to the decision-making centers of the brain. And then those will then in turn send information really quickly to action parts of the brain, so you can quickly swerve. And that's just more instinctual behavior. When it comes down to making more goal-directed behavior, that's when that's when you bring in the prefrontal cortex, and that involves actual simulation of these kind of multifaceted contexts in order to try and understand what might happen if you made a particular action in a particular context. And then you could simulate a situation or a bunch of different situations where you could try and understand how you could get more reward or achieve the outcome you want. And that's not an instinctual decision, because it involves all this prospection, and it involves choosing among multiple different hypothetical contexts.
Got it. And of those types of parts of the brain, is there one that is the person, for example, in my last interview, Blue was referring to a 73-year-old woman who wants to stop drinking, but she can't. Everything in her conscious mind wants to stop drinking, but there's some other force that seems to be, there's this cognitive dissonance. What part of the brain is doing that, causing that dissonance?
Yeah, so it's not totally known, but I think it's probably these subcortical dopamine areas, like the ventral tegmental area, the basal ganglia, the ventral striatum, and the nucleus accumbens. And those areas all basically project to the goal-directed behavior parts of the brain, how do we make actions in particular contexts to achieve particular goals, and then also our memory centers. So it's not totally known, but the the big dopamine inputs that are coming from the potential reward of alcohol could be obscuring negative memories about using a substance, or could be obscuring negative outcomes from actions that you've previously remembered or that you've previously undergone that have involved using that substance.
One thing that you mentioned before is deep brain stimulation. And it sounds like this has been with your studies for some time. Could you explain what that is and what the importance of that is?
Yeah, so deep brain stimulation is this really cool technique or treatment for brain disorders. And the way it works is, rather than having a drug go into the system and affect every part of the brain all at once, it's just a very focused delivery of electrical current to a specific part of the brain. And this has really been used a lot in Parkinson's disorder or Parkinson's disease, where subjects either have shaky movements or they can't move. And by stimulating a particular part of the brain, you can basically restore fluid movement in these people. After the success of deep brain stimulation in that disease, people have also started trying to use it for other diseases. Currently, they're using it for major depressive disorder, impulse control disorders like impulsive overeating is the main one, and then obsessive compulsive disorder is a big one, potentially chronic pain, and then also Tourette's syndrome. And basically, if you stimulate different parts of the brain, you can ameliorate the effects of these different disorders. Yeah.
In the 12-step model, alcoholism is considered a disorder. I should say a disease.
Mm-hmm.
In fact, in the big book of 12-step, one thing that really stood out is the allergy. They refer to it as an allergy. If it is a disease, and that's debatable, if it is a disease, could this type of therapy help?
Yeah, so that's one of the major goals is if you put this stimulating electrode in what's called the subthalamic nucleus for Parkinson's disease, that nucleus is sending out that area of the brain is sending out these really bad signals to the rest of the brain, and that's stopping your ability to move fluidly. It's similar with these dopamine areas that we were just talking about for decision making in substance use disorders. So if you put the electrode in the nucleus accumbens, which is one of the areas I mentioned that kind of feeds up to the prefrontal cortex, you can stop these big aberrant signals that might erase the memories of bad outcomes or might interrupt these negative learned goal-oriented behaviors that you have. And so that's kind of the strategy. And the interesting thing is you can start to learn how, with these devices, you can start to predict when someone is craving a substance by the signals coming into that area, and then you can zap following that, or you can deliver electricity following that, observing that signal, and in that way you can try and stop these like craving oriented behaviors.
Now, you were talking about Parkinson's and dopamine, and from a layman's perspective, it sounded like you were saying that there's a lack of dopamine in case of Parkinson's.
Yeah, I think so. Yeah, mm-hmm.
Because it's interesting. Like there was this psychiatrist I was speaking to the other day. She was talking about in the case of many addicts, there seems to be some evidence. And again, this is debatable evidence that there's a lack of dopamine. This it's a precondition for developing addiction. Mm. Is there some evidence to that you've encountered?
That I'm not sure. I just know. In my world, basically, I think of dopamine as representing the difference between predicted reward and the actual reward, and that the dopamine neurons in the brain really encode that perfectly. And so when that difference starts to be underrepresented or overrepresented, then it can lead to maladaptive decisions, basically. Yeah.
And finally, to move to the last topic today, the therapy you mentioned, I think needs to be explored further, right? How do you feel about some studies that are using psychedelics for the treatment of opioid addiction, alcoholism, and related anxiety, depression, right? What do you know about those studies? Are they, is there hope for studying these, or?
I think so, yeah. I mean, the results, haven't read up a ton on these, but from the results I've seen, they seem really promising. And one study in particular showed that like DMT and psilocybin have basically the same effect on like memory structures that exercise does, and like releasing this chemical called brain-derived neurotropic factor, which allows cells to grow out their processes better, which is a big problem with alcoholism, and particularly where those processes kind of shrink down and are probably, it's reducing the dimensionality of representations in the brain. Mm-hmm.
Interesting. Yeah. Is there anything you'd like to add where you feel like your research may overlap with the research of those doing addiction recovery? And
I don't know. There's not much overlap, but I'd love to record from someone's brain while they're taking a TMT or like a psilocybin or something.
So if people were interested in contacting you or your department, where would they reach you?
They could send me an email at e.h.smith@utah.edu.
Okay. Thank you, Dr. Smith. It's been an honor to interview you today.
Thanks.
Thank you.